Again, my name's Daniel Score. I'm with Fertility Specialists of Texas. I really want to be more about you guys asking questions that you specifically have. I will do a brief overview of our practice and kind of what to expect from a practice in Texas, which as I said before, you're like, why would I go to Texas? But trust me that we do this every day, and people come to us because it is so easy to do this in Texas, okay? So that's me. You can follow, I have a professional Instagram also. You can follow if you want, Dr. Score Fertility. If you need to directly contact me, please feel free to email me. I'm wearing the exact same outfit. I don't know about that choice, Tessa. Okay, so why Fertility Specialists of Texas? Well, first of all, I'm going to tell you why I joined Fertility Specialists of Texas. So I joined in August of last year. I joined Fertility Specialists of Texas because of its involvement in the LGBTQ community, okay? As you can see, since I started in August of last year, I've already been involved in a ton of activities, involved in the LGBT community locally in Dallas. So this was Pride. We're very involved in Pride every year. This year I think we're marching in the parade. Normally we'll have a table set up to talk to people. Rainbow Roundup is a local organization in Dallas associated with a larger national organization. We give money to that organization. They are promoting kind of LGBTQ families, and they do all kinds of events to provide safe spaces for those kind of families. And then this was in Men Having Babies in New York, and this is one of the babies that we created. So why Fertility Specialists of Texas? So first of all, that was the first thing, we're very involved in the LGBTQ community. There are practices in Texas that do not treat LGBTQ patients, period. Okay, so yes, it is a red state, okay, but we do have really, really good surrogacy laws, which I'll talk about later, and there are practices like the one that I've joined. Dr. Goldstein, our founding partner, he has been involved in Men Having Babies for very many years, so I've kind of grabbed onto his coattails in a way, but he hired a gay doctor, so we had to expect that this was going to happen. So why else do you choose Fertility Specialists of Texas? Success, right? Everyone wants a baby at the end of this story. Now this is looking at fertility patients of all of our fertility patients, but the important category is all the way on the left here, egg donors, okay? Pregnancy rates for egg donors who do genetic testing on their embryos are 77%. So you're going to hear a lot of numbers when you're going to different people and success rates and things like that, but this is well above the national average, okay? Now, we also have a guarantee program available as well. Pricing is a little bit different if you use the guarantee in terms of bringing home a baby is the guarantee, okay? We'll give you all of your money back that you've given to the fertility clinic if you don't go home with a baby at the end of the cycle, and that's a very different pricing sheet, et cetera. If you're interested in that program, you have to let us know at the beginning. Most patients, so this is with the first cycle of IVF, choose not to do that because they're very, very likely to have a baby. We also have a lab that's pretty well-renowned. Our lab director is Carlos Guerrero, who's phenomenal. That's him here looking at embryos. We have 5 embryologists, great safety protocols. Everyone's going to tell you that their lab's amazing. I'm sure you've already heard it 5 times today, right? But I will say, like compared to other places I've worked, the lab at our facility is really second to none. We also have an in-house egg donor program. So, as I talked about before, in terms of cost, that's one of the main reasons a lot of patients come to us is because it's significantly cheaper to go to Texas because we don't have income tax. We can pay people less. All the associated fees are less, and we transfer that savings to our patients every day, okay? If you choose an in-house egg donor, that will lower the cost even more, right? You're getting rid of legal. The fees to those egg donors are less. They don't have to travel into Dallas to do their cycle. They're in Dallas. We have about 40 people that are pre-screened and ready to go, type people, who have either done before or not. And you can choose one of those people. We also do work with egg donor agencies around the country, et cetera, or in Dallas. So if you wanted something very specific, we can try to find that for you, or you can go to one of those other agencies. We do participate in GPAP. We have unlimited stage 1 cases. I don't know if they've talked to you about a GPAP yet at the conference, but if not, you will learn what that means. Stage 1 cases and then 1 stage 2 case annually. We work with the top surrogacy agencies around the country, quickly match you with a gestational carrier. People often ask me, do we recommend a specific surrogacy company? Not necessarily. We work with them all over the country. There are surrogacy companies in Texas, so that can lower cost for you as well, since the gestational carrier doesn't have to travel. But we work with gestational carriers and surrogacy companies around the country. And then I already talked about the guarantee program. It's called Shared Dreams. You can look on our website about that. If you're interested in specific pricing, we can get in touch with you about that as well if you email us. So I'm here with 2 other people from my practice. Sarah Kramer, who's a third-party coordinator. So she's a medical assistant who works in our department. And then Tessa Falk is in the back. She was the one handing out the sperm. She is a marketing person, but does know a lot of things. Another reason I moved to Texas, I've never lived in Texas until recently, are these 2 guys right here. These are my nephews who live in Dallas as well. So, and this was me in San Francisco and having babies. So that's it. What questions do you guys have for me? That's really what I wanted this for, was for you guys to be able to ask questions.
So this cost that's on this cost sheet,
Yeah.
$22,000, that's for in-house donor egg and gestational carrier IVF. So that is not the cost associated with the surrogate themselves.
Correct. That would be external through the surrogacy company, unless you have a friend or something who would want to be your surrogate.
Right.
Yes, that's a separate fee. I guess my presentation was too good, huh? You gotta have questions. You're probably just overwhelmed from today. I remember the first conference I went to in New York, I was like, this is crazy, the amount of information. Go ahead.
For your egg donors, do you have one of color?
We do. I will say that our egg donors are representative of the population of North Texas, okay? So we have a majority white Latino. We do have some Asian, some African American, but we can, if you get in touch with us, we can send you an email password to get into so you can see what we have available. And we often will work with people, if possible, to kind of try to find someone for them if they're willing to wait. Sometimes people are like, I don't want to wait for you to try to find someone. I'll just go to a different egg donor agency and bring them to you, which is fine also.
You can find me after this and I can give you my business card. You can email me and I'm happy to give you a password to take a look at our in-house database. Okay?
Yep.
Do you have like a ballpark figure of like all in if you're working with another Texas agency for the surrogacy match? Like about how much?
So the doctor really doesn't handle the financial.
No.
We kind of keep him onto making your baby. But if you have financial questions, please find Tessa and I after this, and we're happy to discuss any financial questions that you guys have.
I can say though, in general, when you compare us to the coasts and those clinics, we're going to be in the $30,000 to $50,000 less.
Okay.
If you do that specific scenario.
Yep.
What's the difference in price in the guarantee program versus the global package?
That I don't know off the top of my head. I know for when, do you know?
What was the question?
Shared Dreams, what the difference in cost of the package. That's something I think we would have to get back in touch with you.
Yes, we would definitely have to get back in touch with you. As far as the Shared Dreams, what we have is basic overview, and those kind of start to get specific for
The
you
billing
and-
department.
Right, you and your journey.
Most patients decide not to do it because the pregnancy rate is so high. And if you use an in-house donor, you're likely going to have a lot of embryos frozen. When we do an in-house egg donor patient, they are stimulated for IVF. Every egg that is retrieved from that cycle is yours, okay? So, versus if you go to a egg bank that sells you a lot of 6 to 8 eggs, right? So most of our donors are collecting between 20 and 30 eggs. Okay, which is much better for split insemination if that's something you're interested in, is much better for future children, and freezing every year is nominal, generally.
So the patient age is the surrogate age? Or
Correct.
Okay.
You're always looking at the age of the surrogate, and donors are generally under age 30.
Mm-hmm.
These are infertile couples. We're not dealing with any kind of infertility when we're dealing with people like you, generally. Sometimes, rarely, we will have someone with some male factor, which is easily overcome nowadays with ICSI, but which they'll teach you about tomorrow. Actually, I think I'm giving that part of the talk tomorrow.
Are you?
I'm doing the
Amazing.
medical one, yeah.
Okay.
So maybe a silly question. You guys do the infertility plus the egg donor, the surrogate's outside. Would we need an agency then, a different agency to wrap this all together?
No. So generally, it's just the surrogacy agency and us. That's it.
Awesome.
So you guys would provide the lawyers, legal team, and all of that that would also go into the set, like basically.
For if you use an in-house egg donor, yes.
Yeah, okay.
Generally, the surrogacy agency will deal with the legal for that gestational carrier. Anything else?
Are the anything you want to add as like birth rate? Put you on the spot.
So I am a third-party coordinator. Guess I should
Yeah,
stand up
stand.
for this, right? So typically when you're ready to have a conversation with Dr. Skora, we're happy to set up a Skype or Zoom consultation. And then he can go over your specific needs. Everybody here is different. Their journey is different. Their expectations are different. Their outcomes are different. Personalities are different. Your egg donor selections are important. So once you see Dr. Skora or have a Skype Skype consult with him, you would meet with a third-party coordinator. We would go over the specifics on egg donors, gestational carriers, exactly what to expect on their process of their medical screening through their retrievals, through their transfers, through their what we call graduating, which is a release to their OB. You will have the same coordinator. We feel really, really strongly that there's enough hands in the pot already. So if you have one coordinator that does your whole entire journey, there's a lot less room for error.
Yeah.
You guys deserve the best of the best, and I think that Fertility Specialist of Texas is one of the best because I'm staying there. The doctors are great. Dr. Skora, as our newest doctor, is amazing and so much fun, so much knowledgeable, and Tessa, our awesome marketing, put all of this together. So. Great for you, and the sperm cookies. Everybody loves the sperm cookies. So if any of you would like, a password to our in-house donor program, I will
Feel
stand
free
at the
to-
door
yeah.
for a little bit and hand
Give
out my
me a-
business card. You guys can reach out to me, and I'm happy to get you set up, just so you get an idea of what it is to look at an egg donor profile. It can get tedious and overwhelming. You're logging on to some agencies that have thousands of egg donors, and these are pages and pages and pages of all their information. This at least gives you an idea of what it is you are starting to care about. Do you care about education? Do you care about their ethnicity? Do you care about their height, their hair color, their eye color, their family history, right? All of those things are all listed.
As well as if they've had a successful pregnancy from their eggs before.
Yes, and then obviously we also have all of their statistics if they have donated previously. So we can typically give you the information about how many eggs that they have retrieved, how many actually made it to an embryo, and if there was PGS testing done, how many normal embryos we got back. And then I can also let you know if there's an actual positive pregnancy from an embryo from the specific in-house donor. We do work with all agencies, and we are happy. What's most important to me is that you feel that you've selected the correct person. You're never going to feel pushed about our in-house donor program. I really want you to, every time I sit with somebody, they're like, I just connected with her. I saw her pictures, and she's everything that I want. That's what I want for you. This is your experience. You're in charge. We run kind of behind you. We let you make the decisions, and we go as fast or as slow as you need to. And my job is to make this as smooth and as stress-free as possible. And then obviously I have Dr. Scora that anytime that I have questions or concerns, I'm going to go directly to him, and him and I will both reach out to you to discuss, hey, we're at this point. I heard a gentleman earlier saying there are bumps in the road. Sometimes there are failure. Just know that you're always going to have access to your doctor. He's never ever going to be like, I'm not making that phone call. So we'll always call you and keep you informed and let you make the decision on the next step. With that, do you guys have any questions about egg donors or gestational carriers?
Dr. Score, can you just kind of talk, we've had several questions about, why Texas, and you kind of talked on that, but one of the benefits about pairing with a clinic, not a clinic, but a surrogacy agency in Dallas, kind of that.
Yeah, so if you choose a surrogacy agency in Texas or in Dallas, it definitely decreases the costs, because all those gestational carriers, they have to go to the clinic to have their transfers, to be monitored, to do all their medical treatment. So you're saving, excuse me, you're saving on that just travel expense to begin with. You're also saving because, as I said before, things in Texas are less. People expect less money for things. There's no income tax, right? So a gestational carrier that is being paid $70,000 in California doesn't need to be paid that much in Texas because of that expectation that people just make less money and the money goes farther, if that makes sense, okay? So those are kind of the two things that make that significantly cheaper for patients. Anything else? Yeah?
In terms of egg donors, are there certain depths of the medical history? I mean, of course, there's variations in the amount of data that you have access to when you're getting an egg donor. Is there sort of like a universal minimum amount of data that is required in order for that egg donor to be considered viable or available to you?
Definitely.
Every place is different, though. Okay, so Sarah can speak to specifically what our egg donors have to have testing-wise and what is in their history. Go ahead, Sarah.
So we're obviously looking at her medical history, family. That means mother, father, siblings, grandparents. Genetic testing, right? We bring them in for our pre-screening. We do a test that's called an AMH. So every woman makes one mature follicle a month and ovulates. So we're able to take a look on a sonogram and see what she has as far as mature eggs, but an AMH kind of gives us a window of what else is in there that we can't see. So we have a standard, is a result, I don't know which one I'm trying to think, there's a protocol that they have to fall in on that AMH. We do genetic carrier screening, which tests for 380.
I'm not sure which one we use for the egg donors.
I believe it's 380 genetic carrying genes. If she's negative, no problem. If she just pops back positive for something, the company that we use is called NextGen, and we would then send you a kit in the mail where you would just, wipe your mouth and then send it back. That is free of charge, and we would be testing you specifically for what the egg donor popped up as positive. And if you are negative, then we're fine and we can move forward. We are one of the very few clinics that we also test chromosomes on the egg donors prior to their first retrievals, just because we scientifically are trying to, we're scientifically trying to give you the healthiest baby that we can.